welcome to Fast Intelligent Care. We are here for part 3 with Belinda Dwyer. She is a OT lecturer at Flinders University. In our previous episodes, we talked about her background, student experiences, pressure care education specifically, and a little bit about how they experience placement. So I guess my first question is, what are some of the common gaps that you notice or that students have noticed once they've gone into placement with regards to pressure care?
It goes back to what we sort of discussed before about being able to understand, how the skin reacts, looking at skin perfusion, skin breakdown, and a lot of them were sort of feeding back that they didn't really understand the concept of how long-term the issue can be. While we can talk about the fact that once you've had a pressure injury, there's always going to be that vulnerability there, until they've actually seen that and seen the positive impact that pressure injury strategies have had on the individual, but also the fact that it needs to be a longer term consideration. I don't think they understand the brevity of that until they've actually seen it.
I was talking to someone recently about pressure care, and I remember them asking like, is that a very serious thing? And I was like, it's actually the second most common hospital related injury. Which they were like, oh wow, like I didn't know that was so serious. A lot of people know about infections and things like that, but I think still a long way to go in terms of the seriousness of pressure injuries.
And I think a lot of the focus tends to be on heels, the key points, the heels, the sacrum. Some of the students were sort of saying even they didn't sort of understand or recognise how common even just ear and shoulder pressure injuries were from side lying.
True. We do very much focus on those specific areas. So I guess when you get to a client that has a pressure injury in an abnormal area, like what do I do with this? How do I avoid getting any pressure on that area? So that's a good point. And you've had some students that have now graduated and are now practicing. That have given you a bit of feedback on how that's gone, how they've experienced their first year out of uni. Would you love to share those?
So I've reached out to a number of students, so thank you to Clary, Emma and Rutu for providing some feedback. I suppose what some of the common themes that came back were that they were surprised at sometimes the lack of knowledge of pressure injury care from sort of the broader team, if they're not then weren't working in that specifically. The amount of equipment, which we've touched upon before, the huge range of equipment that is available, can be overwhelming in terms of those decision making. More how often they do come across a pressure injury and how quickly it can deteriorate. And the importance of continuing with pressure management strategies even after it has healed. So that's what they felt that they really didn't grasp the concept of until they're actually out working in that area.
And you talked about like the knowledge of the broader team in terms of pressure care. Is that OTs or is that like with
multidiscipline? So it might be carers, nursing.
Okay, that's very interesting.
That some saw it as a specialised area, which it is, rather than across, I suppose, general care.
And actually, something that I just thought about is I know with the pressure injury guidelines, there is mention of like nutrition. There's mention in wound care. We're talking about like hydration of the skin, things like that. Is that something that OTs are aware of, like when to refer, how to bring the rest of the team in, or knowing what's their responsibility and when is it out of their scope? When is it something that they have to or advocate for others to come in?
Well, obviously coming from the educator point of view, we very much encourage that multidisciplinary team approach. So, and for OTs, sticking within your scope. So we're looking at sort of occupation, positioning, etc. While the tools that we use such as Purpose Tea, Waterloo, will look at nutrition, it isn't something that we would be strongly encouraging OTs to be chasing up or taking on. That's the role of nutrition and dietetics. So very much encouraging OTs to stay within their scope, but making them aware that this is a team approach. It's a multidisciplinary team approach. It's not just an OT approach or an incontinence nurse approach, that everyone works together, and when everyone works together collaboratively, then we're getting the best outcome for the client rather than everyone working in silos. And
a question I get quite often from OTs is it their responsibility to be staging the pressure injury?
No.
Is that something that you would want the nurses to do?
Nurses, yeah. So we basically will tell them that is a medical field. OTs are really focusing on that occupational engagement. So what interventions, whether it be support surfaces, look at how that person's moving, sitting, how they are transferring, how they're being positioned to engage in those meaningful occupations is the OT role, and then knowing when to and how to communicate with the rest of the team so that you do have that, as I said, that collaborative approach.
Would it still be correct to say that as OTs we should still know the pressure injury stages in terms of educating whether it's family members or carers, even though we're not necessarily going to be staging the pressure injury, but just knowing how it progresses, what it looks like?
Oh, look, absolutely. Yeah. And I had one of the new grads talking about receiving a referral from a clinician for a Roho cushion where the client had necrotizing fasciitis and should have been completely offloaded. So certainly it's important as part of that clinical reasoning and determining appropriate interventions that OTs are aware of the different stages. However, in terms of actually staging it, unless I think they're working in that and that is their clear scope of practice, I wouldn't be expecting that. Certainly our students on placement or early grads would be they might be involved in it, but that's I suppose the extent of it.
Yes, no, it's good. I think it's good for OTs to know as well, because I think it does. It's a very common question I get, and I think it does stress OTs out to be like, oh, do I need a stage this? Am I the only one that's focusing on pressure care? Because I think it does. At least when I was working in South Africa, pressure care is very much the focus of OT.
Yep.
Even in terms of I had to train the nursing staff.
Yeah.
So any role where no one's sure who needs to do it, it gets thrown to OTs because we have a broad range of knowledge across a lot of things. So a lot of things do get put onto us, but I think it's good to know when it's out of our scope and when you need to refer to others.
So I think my experience in Australia is that generally it is a multidisciplinary team approach. However, when there are agencies are under-resourced, then the OT may then take on a little bit more as a result. And quite often we see that in sort of rural areas where they don't have access to the resources that we have in metro areas a lot of the time. So,
and I guess it's good having that knowledge as well in terms of advocating for that as well.
Yeah.
If OTs do see that maybe the approach to pressure care isn't maybe up to date or isn't there isn't necessarily as much support, they can advocate for that and know what to ask for.
Yeah.
Great. Thank you for the wonderful feedback that you've gotten from those OTs. Thank you everyone for listening, and thank you for Belinda for all your wonderful knowledge and for being here. We'll see you in the next episode next Tuesday.